Forms are super important. First of all, there are documents that help the patient understand what to expect from their experience at the office. So the more clear you are on your forms, the better for the patient and for the doctor in any future communication. It also helps set the expectation that this is a medical visit instead of a dental visit. So when you're doing proper intake with your patients and you're using proper verbal skills, which we also coach on, then you have a better opportunity to build a proper relationship from the beginning. I find that dental patients who miss that experience, both in documentation and in verbal communication at the very start of their visit, become tire kickers. They're going to price around, they're going to go to different, this is not the tire store. So no, this is a health condition. And for some reason, there's a disconnect between the health and the body. And having proper documentation, especially SOAP notes, when you go back to explain something for the patient, you're not skipping over those oral systemic connections. They can begin to wrap their head around the fact that, okay, I have something going into my mouth that can affect the rest of my body. And in some cases, your life. That's why there's comorbid conditions between periodontal disease and heart disease. That's why you need surgical clearances, for instance, before you have joint surgery. Yeah, the bacteria is not a joke, and it does infect the rest of your body. It doesn't stay isolated in the mouth. Occlusal conditions can cause headaches, all kinds of different things. They're finding correlation between pediatric airway, for instance, and behavioral issues like what we call hyperactivity disorder, ADHD. A lot of kids have improved behavior when they have correct airway. So there's so many different things that dentistry can affect that we've not traditionally thought of, but the science is there and it's growing every day. So the nerd dentists already know this because when they go to their CE, they're learning all of this stuff. But even if they learn it, they go, okay, so what's next? I have so many doctors, for instance, who want to go into dental sleep medicine, but what's next? Is this something I can do in my office? And how do I help my patients understand the airway issues that are going on?